So what I wanted to talk about was just a little bit of sort of health outside of like racing and training, and why I think it's really important to actually look at blood work and sort of work with your doctor, work with your dietitian, work with whoever it is that's looking after you, and actually use that information to maximize health and obviously maximize performance. So what I'm outlining here is just a few key points that I think are very important to the endurance athlete. And I know we have a couple of people on the call today that certainly can share their experience with what they found with their blood work. But from the first thing to say is that this is not about like a blood type diet. So you will see reports of like, you know, if you're O negative, you should be eating these type of foods and so on. Utter BS. I think there's plenty of studies now showing that's not really the case, and you don't need to be prescribing to that type of diet. What this is talking about is looking at scientifically proven markers in your blood that will relate to health and ultimately to some performance. So the first thing is your iron panel. And I think, as a lot of you will know, in endurance sports, that iron can become depleted through endurance activity. And if you end up being deficient in iron, then you're going to end up anemic. Your iron is going to relate directly to cardiorespiratory fitness and energy levels. So it's going to be responsible for things like hemoglobin, hematocrit, your oxygen carrying capacity of the red blood cells. And so that's very, very important. And Danny, you're there, aren't you?
Yep.
Yeah, I mean, do you want to, without putting you on the spot too much, but I mean, your experience with sort of iron panels and you being a pro athlete, I mean, do you have any commentary on that?
Yeah, I actually have been anemic in the past, and am currently working right now with a provider to increase my ferritin levels. So it's something that I do pay close attention to, and have tried a few different supplements, and I'm currently on like week 6 of an increased dose.
Yep. How much are you taking? Actually, do you know what? We'll get into what you're doing in the next slide. And just, I guess, from your point of view, when you found, did you know you were anemic before you had a blood test?
Nope.
And how were you feeling? How was your training and how was your racing up until that point?
So I think this last time I didn't really notice all that much. The first time that I found out I was anemic, and the first time I started supplementing, I noticed a big difference. I didn't after, though. I didn't, like, in the moment, I thought that was normal. I was just kind of tired all the time, and you know, I was waking up early and training a lot, so I thought it was par for the course. But once I started supplementing, my energy levels really came back. Yeah. This last time, it wasn't as pronounced of a difference. I'm due to get a blood test here in a couple of weeks to see how I'm doing, but I can tell my just overall energy is better.
Yeah, no, that's great. Jay, do you have anything you want to comment on that? I think your iron's always been pretty good, and we'll probably discuss in terms of diet why that may be in a sec as well. Okay, so the next one we're going to talk about is vitamin D, and you will hear about vitamin D a lot. It's thrown around everywhere. It's your sunshine vitamin. Unfortunately, in the northern, and what it's responsible for is obviously bone health, muscle health, mood. There are links to cardiorespiratory fitness, tendon health, you name it, vitamin D is being linked to it. Certainly in terms of bone health and mood, I think there's some fairly strong evidence to say that it is very important. In terms of vitamin D and being on top of this, I think what you're going to find is that majority of endurance athletes are going to be probably insufficient or deficient in vitamin D. The reason for that, I think, is because majority of you get up very early in the morning, you're fully clothed, you wear sunglasses at every moment that you can when you're riding and when you're running. And then you're probably in an office type job where you're not getting any exposure to sunlight. And then by the time you get home, it's probably dark. So vitamin D is obviously created mainly through sun exposure. You then couple that with being in the Northern Hemisphere where for a good proportion of the year, the sunlight and the wavelength isn't going to actually result in production of vitamin D. So what you're going to have to then do is probably supplement with that. And we'll get into the supplementation regime around that as well. B12. I lost everyone.
Oh, still here.
Oh, you're there. Sorry, I couldn't hear anyone, and I was like, "What's happening?" That's all right. You're all there. Cool.
Yeah.
Then B12 is really about energy, and also can be associated with anemia. And you can get, in terms of B12 deficiencies as well, that can have serious impact on cognition and neuropathies. Then we look at HbA1c, which is going to be a measure of diabetes, metabolic syndrome. What the HbA1c will give you a measure of is your 90-day measure of glucose attached to hemoglobin. So it's probably, in my opinion, a better measure of your stability in blood glucose as opposed to a fasting glucose test, which will give you a sort of a point in time. The HbA1c is going to give you a much more consistent overview of what's happening on over a weekly sort of basis. And then the final one there that you may want to get assessed is your omega index. And this is really going to be probably a good indication of inflammation, systemic inflammation, that is, and probably chronic inflammation as opposed to acute, and how it relates to the mind and the gut. So if we then get into, are there any questions about that in terms of just those 6 markers?
Question on iron panel. So is it concerning if your iron is too high versus too low?
So it's a really good question, and this would probably relate more to a genetic disorder called hemochromatosis. Hemochromatosis will generally be picked up because the individual will have very dark sort of red rings around their eyes, and that's a genetic disorder. If you have hemochromatosis, then giving blood regularly, donating blood is one way to help control that. Obviously, minimizing the intake of iron-containing foods, and that's increased iron intake as well. If you're supplementing with iron, you don't need it. You'll probably find that your gut motility, or the ability to pass stools, is probably going to be reduced, and they'll end up very black. So that's probably another reason where high iron consumption could cause issues. I couldn't tell you off the top of my head how high iron relates to chronic disease. I'd imagine it has some impact on sort of bowel disease along those lines.
Cool.
So if we look at then, what do you do? I think it's always one of those ones, isn't it? You always get told, you've got to look at this, you got to look at that in terms of, to look at how that could impact your health. But then it's always like, well, what do I do if there is an issue? And I think first and foremost, discuss with your doctor. I'm not a doctor. I have an interest in this information. I have knowledge about this information, but I'm certainly not a doctor and not going to tell you what you should do as a definite. So I think if you are concerned, talk to your doctor, and obviously you need to trust that doctor. And I guess some doctors have an interest in this, and some doctors will tend to blast it off. I think what's really important for athletes to really emphasize to the doctor is that they are an endurance athlete, and therefore you're not sitting on your ass every day. And where your zone is going to be very different for what is optimal for you versus, say, a sedentary person. And hence why I know back on that graph that I had that little image, that's taken from Inside Tracker. And look, I'm not associated with Inside Tracker. However, I do use it. I use it for all the athletes that I work with because I think it's a fantastic system to quickly visualize the zones that should relate to their optimal health and ultimately will impact their performance. So that's probably my plug for Insight Tracker. But as I said, I'm not associated with them. I just think it's a fantastic service, and majority of my athletes use it and like it. I will love it. So iron. So if we go back to what Danny said, Danny, what dietary preference are you?
I'm pescatarian, I guess, if you would categorize it.
Yeah, so pescatarian. So first thing you need to think about, depending on your dietary preference, is your diet going to be contributing to the micronutrients and obviously the macronutrients that you're going to be requiring? So if you think of where iron comes from, and heme iron in particular, which is far more bioavailable for a human being in terms of absorption of iron, that comes from meat products. And your best sources are going to be meat products, so lamb, beef, pork to a degree. Now, if you're a vegetarian, a pescatarian, a vegan, the amount of iron in your diet is going to be reduced, especially heme iron. Now, you will be getting non-heme iron, but as I said, the bioavailability of that is reduced. So you need to consider that, and that's where probably getting a blood test early on, if you're vegetarian or vegan, is going to be very important. If you're not, then what you need to look at, and if you do get assessed and your iron levels, so when we talk about iron panel as well, where you look at a number of different markers, so you can look at serum iron, which is the iron in your blood, and then you can look at ferritin, which is more the store of iron intramuscularly, and that's all between your muscles, and that's going to be a better measure of sort of your iron storage. You then look at hemoglobin and hematocrit, which is probably going to be impacted by your ferritin and your serum iron levels, and so on. So there's a number of different markers within the iron panel that need to be observed. What's the other one? The iron binding capacity is going to be important, and that's going to be affected. And for a doctor or anyone who's working with you to make the diagnosis of anemia, they need to be looking at ferritin, serum iron, the total iron binding capacity, and probably your hemoglobin as well, to make that diagnosis. So if there are issues with that, and if you were repeated testing, it was still low, and then you were supplementing, I would then probably start to question, depending on your age, whether you have some issues with gut absorption. So depending on your age, if you're 45 or over, should you be looking at having a colonoscopy to, I would say, rule out or exclude any nasties that could be causing malabsorption in the gut. And that's probably, again, a medical decision that you need to talk with your doctor. But certainly if you're over 45 and you had issues with iron absorption, I'd be looking at that. And then if you've got a family history of any type of bowel cancer, you'd certainly be pushing forwards with that. You then think about if you've got things like irritable bowel syndrome or any Crohn's disease or celiac, that's going to have an impact on the microbiome, and that is going to have an impact on the absorption of iron. Some interesting studies have looked at supplementing with lactobacillus and acidophilus and what's the other one? Bifidobacterium. And those three species of bacteria, when consumed on an alternate day basis with iron on an alternate basis, has been shown to improve iron absorption. So that is something that you could consider as well. I think the things to consider is obviously that the iron supplement is of heme iron form to improve the absorption. Alternate day dosing is recommended. Danny, how are you doing your dosing?
I actually do every day dosing, and I take ferrous bisglycinate,
Yep.
which is supposed to be a little gentler on the stomach. And then I, as you note here, make sure to avoid caffeine and dairy at the time when I take that, and also do it at a different time than my calcium supplement.
Yep. So, and that's really good. I would say that pretty much all the evidence points to doing alternate day dosing and taking it in conjunction with vitamin C. So I would recommend taking at least 100 milligrams of vitamin C with it, if not just a 500 milligram vitamin C tablet. But it would be worth talking to your doctor about the alternate day dosing and looking at the evidence for that. The advantage of that as well is you don't have to do it every day, which is quite nice. So, but you're correct. You want to avoid caffeine and dairy at the time of consumption. So I put a question mark there whether evenings are the best. And I think it's probably makes sense. Take it in the evening. You can have some orange juice with it if you prefer to have vitamin C in the form of juice, and just take it in the evening. I think is probably the easiest way, and then it gets to settle overnight. So really up to you, but yeah, I would look at the alternate day dosing. In terms of the amounts that you want to be taking, I mean, how much are you taking milligrams of elemental iron?
So I was taking 36 milligrams,
Yep.
but I've doubled that in the last, I think it's been 5 or 6 weeks, because my iron was actually went down a little bit, or my ferritin. So we doubled that, and I've been tolerating it fine. And like I said, hopefully the retest works. So now I'm at 72 milligrams.
Yeah, perfect. So somewhere usually between 50 and 100 milligrams on an alternate day basis is recommended with that vitamin C. And I think, again, like this is where regular testing of blood, and look, I appreciate in America it's hard because, you know, getting a blood test costs money. But I think it's one of those ones like how much value do you put on your health and what is that worth? So, you know, if it is a single test for the iron, if we know that that in particular is something that needs to be looked at, then I would certainly advocate for that. If we move on, Justin, did you have any questions about iron, mate?
No, all good.
All good? Cool.
Yep.
Vitamin D. And so we talked about like what I mentioned there was majority of people are deficient in vitamin D. And, you know, Justin just jumped on. And I can tell you now, when I was just looking at his inside tracker before, and, you know, I think back in 2020, you were deficient. You know, and I could tell you now, hand on heart, 95% of the athletes I work with are deficient or insufficient. And more often than not, the doctor will say to them that actually they're fine. They're sort of sitting at that 30 to 40 milligram per deciliter. And, you know, yes, it's borderline insufficient. It's certainly not deficient, but my argument would be it's certainly not optimal for an athlete. And so that optimal range for me, and if you look at the research around the vitamin D levels, sits at around 70 milligrams per deciliter. And that's where you want to be. And if I go back one graph, I'll just go back one graph to there. You can see here, you know, this was another athlete who wasn't necessarily supplementing as much as what he should have been. And we got to this point here and I was like, right, you just need to do this. And so what we put him on was 50,000 IU per week of vitamin D3. That's a Monday to Friday dosing of 10,000 IU a day. He does that for 8 weeks, somewhere between 6 and 8 weeks. He was also consuming 150 micrograms of vitamin K2 Monday to Friday. Lo and behold, his levels go up as expected. And it makes a world of difference. And, you know, whether it's placebo or not, you know, you quite often get improvements in mood. Most of the evidence surrounding mood improvements with vitamin D is if you have a pre-existing sort of mood disorder, i.e. low mood or depression. If you have that and you're vitamin D deficient, then by supplementing with vitamin D and getting your levels up into an optimized zone, you probably will feel better. You will have improvements in mood, which I think is really interesting. So, you know, anecdotally speaking to athletes, some of them feel that. And, you know, I think you do get up very early in the morning to do a lot of your training. So I think anything that can help mood is going to be a benefit to you. I was going to say something. The other way, obviously, of getting vitamin D is sunshine exposure. 15 minutes. I've written budgies. I don't know if you guys know what budgies are, but they're those little swimmers that a lot of Australians tend to wear around on their summer vacations. And full sun exposure is what you're after. So if you can get down to your budgies and no sunglasses as well, and let the sunlight shine on you and get the light through the eyes, then that's another way of certainly improving your vitamin D production. Justin, I think you bought a pair recently, didn't you?
I have no idea what you're talking about. Never heard of that.
just Google budgie smugglers and you'll see.
Okay,
yeah,
now I know.
So B12, we talk about B12, and so B12 is again diet related. Danny, your B12 levels?
I actually started supplementing, and then they were very high, so
Yep.
they're pretty good actually. Yeah.
Yep. So usually again B12 will be related somewhere along the lines of dietary recommendations. So diet will have an impact. So you will get majority of your B12 through meat products, eggs and dairy. So if you're a vegan, it's highly likely that B12 is going to be low, and that would be something that I would look at getting assessed. Again, gut absorption, based on what I said with the iron, should you be looking at colonoscopy, depending on your age, family history, all that. Supplementation looks at around 1 milligram per day. So that's not very much. It's 1,000 micrograms per day. And that's been shown to be very beneficial in terms of getting your B12 levels up. However, if it doesn't work, because it is very much a water-soluble vitamin, whereas vitamin D is a fat-soluble vitamin, and what tends to, that's why you can take high doses of the vitamin D and you'll still see absorption. Because it's a water-soluble vitamin, you may find that even supplementing may not improve it. And so therefore an intramuscular injection may be the best way forward for that. And again, anecdotally, when I've had athletes have the IM injections, they feel pretty amazing afterwards. How long that lasts for, it can last 6 to 8 weeks, and then they may need a booster. Ideally, again, I'm very much a food first practitioner, and I'd prefer you to get your B12 through food, and then probably supplementation, and then maybe the intramuscular injection. So and we talked about HbA1c. This is a measure of blood glucose. I think a lot of athletes are seeing the little Super Sapiens blood glucose monitoring units on every athlete on Instagram at the moment. Is it necessary? I think it's a very interesting concept. I think it's fantastic for racing and training. I think for daily, day-to-day, looking at blood glucose spiking when you eat starchy carbohydrate, for me, it sort of just confirms what should happen naturally. Justin, your experience from a day-to-day basis?
Yeah, I absolutely love it. I mean, it's amazing. You could see the immediate impact of the different types of foods that spike you or result in stable glucose. I think the other thing that has really been beneficial, and I know you're going to get mad at me, but when training, different gels and different blocks have just a crazy impact, and so I've been able to refine what helps during training, because sometimes I find goos will spike you crazy and then drop off pretty rapidly, whereas maybe some other products will have more of a gradual spike and stay up longer.
Yeah, and I think I don't think I'm ever going to get angry at you, man.
Only because I like the goos.
Yeah, I know you like the goos. Look, but I think the point there is like what works for you as an athlete is going to be completely individualized. And I know I posted something on the weekend where I was wearing the Super Sapiens monitor. I was trialing the precision hydration gels. They're 30 grams a pop. I was planning on using 3 per hour to get 90 grams of carbs, and yet my blood glucose level was sitting at around 160. So, I only needed really around just above 60 grams per hour, and actually I felt fine. And I think that's where the real, advantage of that type of system, whether you use Super Sapiens or any other one. Again, I'm not paid by Super Sapiens. I'm trialing it, and thankfully they're allowing a number of athletes that we work with to trial it. And I think that's fantastic. And I think the individualization of what you can then program in terms of race fueling, I think that's the amazing thing. And I think being able to understand how much you require for training and for racing, and what products affect you individually. I think that's where the real value of it is. And so I think that that's an incredible thing. That's obviously for racing and training. I think for just looking at, you know, your day-to-day blood glucose, yes, it's very convenient because it's on your arm and you can just tap it. I think if you can't afford Super Sapiens, then something I've played around with, Contour. It's a capillary pinprick unit. It's great. I mean, as long as you don't mind a little bit of blood on your finger and pricking your finger with a sharp needle every now and then you can get a really good understanding of your blood glucose just simply by doing that. And that's going to only cost you sort of $20 odd to buy one of those units. So I would certainly say if you are interested in your blood glucose and you're interested in how foods affect you, then you can do that. I think the best way of controlling your HbA1c and your blood glucose levels is obviously minimizing your refined processed carbohydrates. And, you know, we'll talk about this a lot on this program where, yes, they're not the devil. Sugar is not the devil. Glucose is not the devil. High fructose corn syrup isn't even the devil. I mean, when we're talking about racing and training and getting the best out of yourself in order to hit peak numbers, then those products are going to be crucial for you. On a day-to-day basis, as everyone will know, I'll talk about leafy greens until I'm green in the face. And it's awesome to hear athletes saying, wow, I've never eaten so many vegetables in my life. And, you know, the reality is those vegetables, I'm getting you to eat them, yes, because they're probably a lot more calorie, they're not as calorie dense, and therefore then they're going to contribute less to total caloric intake, especially if you're trying to get your weight down. But they also contribute a lot to controlling blood sugars. They control micronutrient intake. There was a fascinating study the other day looking at chronological age versus biological age, and the ingestion of just 150 grams of leafy greens on a daily basis has been shown to improve methylation in DNA. And I think it's so cool that something so simple as an intervention, just by eating a lot more vegetables, can have a significant impact on your health. And yeah, not just on your blood work, but maybe on your DNA and maybe on longevity. And then, the next point being omega-3 index. I think dietary, ultimately, you'll hear me bang on about herring and sardines a lot. You need 1,000 milligrams of DHA and probably 2,000 milligrams of EPA. And DHA is to the brain, and EPA is systemic. You need to look at your labels on your fish oils, and they, ultimately, a lot of them on the front of the label will say 1,000 milligrams of fish oil. You look on the back and it's probably 180 milligrams of each of those. So fish oils tend to be, the more you spend, the better the quality. So I would say just look at that in a little bit more detail. I know I'm probably running a little bit behind. The last bit I want to talk about in terms of health is, are there any questions, sorry, related to that, what I was just talking about there in terms of interventions? Anyone?
Just out of curiosity, Scott, for the glucose, when you've seen across your athletes for training and fueling, what level do you like to see the glucose at?
For the training? Well, I think it depends on if you're trying to be at race pace, are you talking?
Yeah.
Look, I think it's completely individualized. I mean, Jay, for me personally, like I feel best at about 160, 180. What's yours, Jay?
I don't know.
Justin? Sorry, Justin. I'm calling Justin, Jay. So, where do you feel best?
Yeah, I don't think I've ever seen mine above 140.
Really?
Yeah.
I mean, mine spiked. Like I can get mine to 220, 230 easy. I think I'm just very sensitive to glucose. Like that's probably where I am. So, and again, to that point, like, I mean, how did you feel at 140?
Great. Amazing.
Yeah, you feel amazing, don't you? And Danny, have you had any experience with this?
No, I'm dying to get my hands on Super Sapiens device though. Yeah.
I'll say what I can do. Yeah, it's fascinating, and it really, I guess also, Jonathan, to your point, what I have found is if I keep my level above 160, around that 150, 160, even when I do like really, well, what I consider long, like if I do a 21K run, I don't really get sore at all afterwards if my glycogen or my carbohydrate intake is high. Whereas you know, I decided to stupidly go and do a 15K run, and I did it without eating. I fasted overnight, didn't eat anything in the morning, did the session. It was probably above Z2. I couldn't walk for 3 days. Like, I was so sore.
Yeah.
And I just, the amount of, like, yes, you want adaptation. Yes, you want some breakdown because that will create physiological adaptation and so on. And you want a little bit of damage, but all I could think of was that amount of damage that I had created in my body exceeded what was actually beneficial. And it's such an important thing to go through, I think, to firstly feel like terrible and then understand, okay, so if I don't do that, and everyone will go on about fasting and its benefits, and yes, for health, there are certainly a lot of benefits in terms of the brain and physiological sort of adaptations. But if you're an athlete, is fasting the best thing for you? I don't know. It's probably an individual thing. Again, people might cope very well with that. Again, you talk about other markers that you're going to have done. I've had, you know, genetic testing, and apparently I carry a gene that relates to muscle soreness, and I have an increased propensity to have increased muscle soreness. One of my best friends, who was performance director at Oracle, Craig McFarlane, he doesn't have that gene, and he doesn't get sore at all. And I was like, oh, that's a bit unfair. But, you know, I can control that level of soreness by using carbohydrates and probably higher amounts of protein. So it's all very interesting, I think, from that, and it's a lot of self-experimentation. I think I know we've got to wrap up, but and we can talk more about this stuff and probably talk more about it afterwards. And I hinted there at the biological versus chronological age. You know, is it worth getting tested? I think it's pretty interesting. I got my chronological age versus my biological age, and you know, you look at your Garmin now has a fitness age. Apparently I'm 20 according to Garmin, so I'll be paying them royalties fairly soon for that lovely information. It made my day this morning because apparently on their new update, they give you your training age. Justin, I would like to have a bet with you that my training age is lower than yours.
I got to look into that.
And Danny, I'd like to know who's got the youngest training age. We can minus our biological age from our training age and see who comes up as the winner. I thought it was kind of cool. I was pretty chuffed when I saw I was 20 again, but I had my chronological age assessed by DNA age, and it came back at 40. I think I was 41. Now I'm 42 or 43. What am I? 42. So I was a year younger, despite all my healthy antics and probably unhealthy antics when I was in my 20s and 30s. You know, it was nice to see that I wasn't at least older than what my biological age is. 2 guys I got it done with, they were 6 years older than what their actual biological age was, and they were a little bit upset by that. So is it going to change your life? No. Is it a little bit of fun and a little bit interesting? Yes. To my point about the leafy greens in that recent study, there's another reason to eat a lot of leafy greens and get those nitrates and all the other benefits into you. In terms of gut health, I've worked at a gut microbiome startup. It was metabolomics. I think the science of metabolomics is fascinating. I think it's certainly better than stool sampling, because stool sampling is just telling you what's in the lower descending colon and what's coming out of you as opposed to what's in you. If it can assess short-chain fatty acids, great. It will tell you that you're at least producing those, and that means you've got a healthy microbiome. I think metabolomics is still in its infancy in terms of what it means, and the testing ability of that, I think, can be affected by you posting in home kits. I think there are sort of methylation and degradation issues with that. Allergy testing, home kits are a waste of money. If you do want to get allergy testing, definitely seek professional testing and get it done in a clinic. And then diet type testing, again, waste of money. Even with the DNA testing, where they can tell you that you're sensitive to carbohydrates or fat, all the studies have shown that there's no difference in effect, that calorie deficit is key. If you're trying to lose weight, calorie intake is key to health. And that's really what it comes down to in a very quick synopsis of other assessments you could look at from a health perspective. And I'm sure there's a heap more out there. I'll probably get lambasted for, criticizing some of them, but, that's my experience, and that's what majority of the science says as well. Any questions?
What do you think about using DNA testing to inform what you should eat? Because there's some companies out there that are starting to.
Well, that's what I'm saying in that diet type testing. So that's what effectively what they're saying is they can tell you that you do better on carbohydrates than you do on fat, and you do better on fat than you do on carbohydrates, and so on. There's no evidence for it, and the studies are, again, when we look at majority of people will go on a diet. I mean, what's the reason most people go on a diet? It's to lose body fat or lose weight. If we're looking at that as the primary outcome for that testing and those type of diets, there is no difference in outcome. The weight lost does not matter whether you're on a high carbohydrate or a high fat diet or an omnivore diet, whatever. It just comes down to the total caloric intake. And that's the biggest take home. And, I could, with the athletes, again, I mean, Justin can give his firsthand experience. He knows if he keeps his calories in check, he sees a lovely drop in body weight and body fat. If he doesn't happen. It's pretty simple.
Thanks for announcing that, Scott.
No, but I mean, but I think on the flip side, Jay, when you're on point, like, you're amazing. And I think that's the point for every athlete is, like, you have good days, you have bad days, you have good weeks, good months. But I think when you lock it in and you're like focused to get that weight down because you know that you perform best at X weight, and just to pump up Justin's tires, he had his best race result in his last race. He got very close to the body weight where he wanted to be. And so, I've had some arguments with good, healthy discussions on social media about weight and how important it is. And it's not the be all end all to be a light athlete, but there is certainly an argument to say that a lighter athlete is going to perform better than a heavier athlete. I just can't see that, there's any real argument there. Is that, if you're carrying, and again, he is not carrying excessive amounts of body fat. I think when we started, he was probably not in the optimal athletic zone. But, being down sub 15% body fat and a body weight where he's 8 kilos lighter, lo and behold, he performs better and gets his best race, result that he's ever had. I think it's pretty clear. And yes, that's N=1, but I could tell you there are a lot of other N's in that process where we've seen improvements in body composition, improvements in weight, and as a result, improvements in race performance. So for me, that's, it's fairly clear. So as much as you want to try and find out the secret sauce to how to, lose weight, and that, unfortunately or fortunately, it's a pretty simple solution. And, the flip side to that, and we talk about lighter athletes, I think being super light is not always the answer as well. And, they're probably more female than male athletes will experience this, and maybe that's anecdotally, but I think when you look through the research as well, there is that obsession to be super light, and I think there's that crux of, like, how light is good, and actually putting on a little bit of weight could be advantageous to female athletes as well. And that comes back to, what is health and what is healthy. And, if we look at your blood work, and there's a whole lot of, damage markers there and unhealthy markers in terms of your blood work, and your body weight is not ideal. You get a DEXA scan and your bone mineral density is not right. And, your body fat percentage as a female is sub 15%. I would be saying, hey, let's put on some weight and let's see how you feel. And again, majority of those athletes, those female athletes, if we are talking about females, will start to feel better. Their menstrual cycles will improve, bone mineral density will hopefully improve, general feelings of lethargy should improve. And I think, you can talk about racing and performing all you want, but, unless you're healthy, you're not going to be a high performing athlete. And, I'd probably, that's where I'll probably finish with this, is that, I think it's all about health. Health is really what every athlete should be striving for, and being a healthy athlete, because I think if you're a healthy athlete, you're going to be a high performing athlete.
Hey, Scott, I just have one question. If you go back to your first page and you look at the categories of the nutrients and the assumption that if someone is in the green range and they're okay, but you wanted to pick one or two categories to optimize performance, what would you say would be something to focus on?
Of those
Yeah.
particular ones?
Yeah.
For performance, I think for an endurance athlete, your iron panel, I think, is key. I mean, your oxygen carrying capacity is going to be determined by your iron panel. So, you know, that's going to affect hematocrit. We know that hematocrit, you know, if you're up in 55%, I think it's 55% and above, you're going to be a high performing endurance athlete. So, you know, hemoglobin, hematocrit, ferritin, iron, TIBC, your total iron binding capacity, I would be looking at that first and foremost. And I think as an endurance athlete, if you've got issues with your iron, it needs to be addressed. Probably second to that would be probably your vitamin D and B12. They're probably the ones.
Okay.
I think if you can get those top three in a good position, then I think from that perspective, I think you're in a good position. And I was looking at yours, mate. You're probably about a year. Yeah, I think it's been 1 year since you had your bloods done, which is a little overdue.
Yeah. Yeah.
So, yeah.
Okay. Thank you.
Cool. Any other questions from anyone else? All good?
All
Okay.
good.
Well, thank you so much to everyone who jumped on today. And as I said, there's going to be a recording of this that we'll put out, and we can just take it from there.
Great. Thanks,
Great.
Scott. Really good talk.
Awesome. Thanks, mate.
Thanks, Scotty.
Okay. Bye.
Thanks, Danny. Thanks, Cam. Speak to you guys soon.
Thank you.
Thanks, Boo. Thanks, Jonathan.